Ureacin-10 Lotion is used as a moisturizer to treat dry, rough, itchy skin and minor skin irritations like diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, decrease itching and flaking, and protect the skin against irritation. Dry skin is caused by a loss of water in the upper layer of the skin, and Ureacin-10 Lotion works by forming an oily layer on the top of the skin that traps water in the skin. It also includes ingredients that soften the top layer of skin cells and help the skin keep in more water, leaving the skin feeling smoother and softer. Make sure to use this product according to the directions. Some products may need to be shaken before use, so be sure to check the label. Apply the lotion to the affected areas of your skin as needed or as directed by your doctor. If you're using it for dry hands, you may need to apply it every time you wash your hands throughout the day. If you're using the lotion for diaper rash, make sure to clean the diaper area well before applying. And if you're using it for radiation skin burns, check with the radiation personnel before applying. Only apply the lotion to the skin and avoid sensitive areas like your eyes, mouth, nose, and vaginal/groin area unless directed otherwise. Make sure to use the lotion regularly for the best results, especially after bathing or showering while your skin is still damp. If your condition doesn't improve or gets worse, seek medical help right away. When using Ureacin-10 Lotion, you may experience some side effects such as burning, stinging, redness, or irritation. If these effects persist or worsen, it's important to inform your doctor or pharmacist right away. Your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects, but it's important to notify your doctor if you notice any unusual changes in your skin or signs of a skin infection. While it's rare, a serious allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not mentioned here. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Ureacin-10 Lotion, make sure to tell your doctor or pharmacist if you are allergic to any of the ingredients in the product, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. If you have skin cuts, infections, or sores, be sure to consult your doctor or pharmacist before using this product. Some ingredients in the lotion, such as preservatives and fragrance, may make you more sensitive to the sun. Check the label for any warnings, and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may suggest that you limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If your skin is prone to acne breakouts, look for the word non-comedogenic on the label, and ask your doctor or pharmacist for more details if the product may stain or discolor clothing. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, be sure to consult your doctor before using this product. When using Ureacin-10 Lotion, it's important to be aware of potential drug interactions. These interactions can affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Remember not to start, stop, or change the dosage of any medicines without your doctor's approval. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or having difficulty breathing, call emergency services. Otherwise, contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. When it comes to preventing dry skin, there are a few simple tips to keep in mind. First, try using lukewarm water instead of hot water when you bathe. It's also a good idea to limit the number of baths or showers you take, aiming for every 1 to 2 days. Keep your baths or showers short, and consider using a humidifier if the air in your home is very dry. There are various emollient products on the market, and they come in different forms such as oils, creams, lotions, or sprays. Some may contain fragrances or other ingredients that could potentially cause sensitivity in some individuals. It's a good idea to consult with your doctor or pharmacist to find the product that may be best for you. If you forget to use Ureacin-10 lotion on your regular schedule, just use it as soon as you remember. But don't use extra lotion or use it more often than directed. The storage information for Ureacin-10 lotion can be found on the package. If you have any questions about how to store it, you can ask your pharmacist. It's important to keep all medications away from children and pets. Make sure not to store the foam canister near high heat or an open flame, and do not puncture or burn the canister because it's under pressure. Don't flush medications down the toilet or pour them into a drain unless you're told to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.